Against abortion campaigners' complaint they include no option but to install a legislative problem if the Scotch by the government approves plans for female to get miscarriage medicine at household. The Community of the Protect of the Future Kid, SPUC, told it had already desired legislative consultation. It told it had been confident a nice opportunity of successful. The Scotch by the government told it had treated difficult to provide female could ever accessing clinical safe services. Dr. Catherine Calderwood told it was considerable advance how female in Scotland who are up to 9 weeks pregnant women could get the other dosage of the narcotic at household if they requested, proverb that would enable them more than confidentiality, more than virtue. Campaigning groups consisting Beget, Pardon Scotland and Rape Her Meltdown Scotland welcomed the Time Professor Leslie Regan, CEO of the King's School of Obstetricians and Gynecologists, RCOG, outlined it as remarkable. But the SPUC's John Deegan declared how the capacity public health risks for female were terrible. He told, where would be no care supervision and the growth will outcome in terrible threats to females' public health. SPUC told it had acquired comprehensive legislative consultation of an lawyer who specializes in humane rights cases, who told how by the law the medicine could not be undertaken out of several shape of care oversight. The lawyer set out, in my type, the take of the abortive drugs must be made by the oversight each of a recorded care medical practitioner, or by several some appropriate term of personnel who is operating by the monitoring of a care medical practitioner. It cannot be made by a patient uncontrolled, at household or in another place. He added, as the adoption anticipates the patient administration the narcotic to herself out of care oversight, how adoption revenue on a wrong direction as to the requirements of the 1967 instrument, and is respectively illegal. Mr. Deegan added, ours consultation is precise and we very include no option but to problem these proposals that go to the mandrel of our beliefs in the law to lifetime for future family and the public health and welfare of his mothers. The by the government plans are not a changing to miscarriage law but to powers accessible during the Miscarriage Act 1967. A Scotch by the government representative told, we've treated difficult to provide female are ever capable to accessing clinical secure services. Scotland is the just portion of the UK to propose female the prospect to get misoprostol at household, while the is clinical relevant, a judgment how allows female to be in monitoring of his treat and as convenient as probable for the order.